I'm gonna
Thank you,
head out.
Phoebe. All
You're
right.
welcome.
Hi, Dr. Lieberman.
Hey, Tom, how are you?
Marvelous. And yourself?
I'm doing well. It's nice to meet you.
Yes, nice to meet you.
Where are you calling from?
Metro St. Louis area, Wentzville, Missouri.
Oh, right on, right on. Driven through. Never really been there much, but definitely driven through.
Okay.
How long you been there?
We have been here right at 20 years now.
Oh, so you must like it.
Yes, it's a fine place.
You retired or what do you do?
I am. I'm retired. Retired as a field chemist, and I have actually one of my cohorts trying to get me back into doing some things now. So
What does a field chemist do?
mostly lab packing is what this would be. So, like you have a laboratory, you need to have the hazardous waste hauled off. We take care of that for people.
Yeah, well, I've been buying your services for decades.
I'm sure you have.
Yeah, a lot. We generate a lot of hazardous waste with the sharps and the chemicals and stuff in surgery. Well, thank you very much for sending me the summary of your care. And I've also got your MRI. I'm looking forward to going through how you've been dealing with this very severe spinal stenosis at L45. But if I could just from you, I'd love to hear it from the horse's mouth if possible. Just
Yep.
tell me when did the symptoms start? And then what did you do about it? I've got your written record, but
Sure.
I'd just like to hear it.
Yep. That's fine. Is this really started June of 2020? And, post COVID, we didn't have COVID at that point, but, lockdowns are starting to end and we're starting to get out and move. And I said, okay, I've been laying around here a while. It's time to get moving again. So I got on my elliptical. And after about a month of being on the elliptical, I'm starting to have leg pain and back discomfort and things like that. And I'm thinking, well, maybe it's just because my foot doesn't move correctly on the elliptical. It's kind of stuck in one position. So I lighten up the load and I keep with it. And then I start cutting back on it. And finally in August, I just flat out stopped because the pain wouldn't go away. The pain persisted, but it actually got to the point where it was bad and affecting my sleep and life in October of 2020. Went to my primary care physician. He said, here, try some muscle relaxants. And I hate those things, but
Yeah.
they don't work well for me. But
Yeah.
I did take them for a while. And by March of 2021, I'm back saying, this is not going away. And now it's causing more problems. So he sent me for an x-ray, and then he sent me to physical therapy. And some of the physical therapy exercises I'm still doing to this day. They took care of me all the way to August of 2021, when they said, after dry needling and beating me up as much as they could, they said, you're not getting any better. So they sent me to pain management, and I had a MRI done at that point, and they started looking at saying, yep, severe spinal stenosis. We can do some shots. And I go, okay, I'm trying to avoid surgery here. And I'm thinking, if I can get my shots, maybe I can exercise my way through this, which I got a series of 3 shots that ended in December of 2021. And by June, I was back at the doctor's office saying I need help again. So this is 2022 now. They gave me a series of shots over 3 months this time, not as close together. Finally, in September of 2022, they changed the location of the shots. They went to the foramen, the side, their side, and that really worked great. I had 9 months of, it didn't go away completely, but my life was okay. And I learned how to avoid things that actually made things hurt. Now we're into this year, and I show up in June again saying, hey, things aren't working. They give me a shot, the same location as that previous one. It did absolutely nothing.
Ah, interesting.
Yeah, absolutely. It was absolutely nothing. And I said, okay, I've tried to exercise. I've taken the shots. At one point, they suggested an ablation, but I thought, well, that's a temporary thing too, and I'm still dealing with a primary problem. So now I've started having discussions with my neurosurgeon, which I've only talked to the PA at this point, but I've seen him 3 times over these prior months and years, and every time between the pain management specialist and my PA neurosurgeon assistant there, they've always said severe spinal stenosis. And oh yeah, by the way, you have a bulging disc. And I go, okay, that's fine. So I'm thinking I'm going to come in here and they're going to start sending me towards some minimally invasive surgery to kind of clean up the spinal stenosis, and I'm going to be fine. They're kind of saying, well, maybe it would be best to have a laminectomy and then we'll do a discotomy. And instead of a 4-month recovery, we're looking at like a year recovery. And I'm going, wow, this is really major. I need to talk to some other people about this. Hence, I'm speaking with you.
Wow. I'm so glad you did. I'm so glad you called. Let's take a look at your MRI first so that we can firmly establish what's going on, and then we'll take it from there, okay?
Sounds great.
All right. Let me pull that up on my screen, and then I'm going to share with you. Yeah, this is a cross section of the MRI of your back. And just to orient you, the surface of your low back is here. And if we go in through some tissue and go past the muscles, we get to the spinous process, which is the bumps that you can feel in your back, in somebody's back. And as that bone goes down, it flattens off into the lamina on each side. And the lamina is the roof of the spinal canal. Remember, we're upside down here. You're lying on your back. So the lamina is the roof of the spinal canal. This white is fluid. And these dots are your nerve roots inside the spinal canal. They look like dots, but they're not. They're actually like spaghetti. But if you held spaghetti on end, it would look like a bunch of little dots. But these are actually tubes that come out of the screen and into the screen and go up and down your spinal canal.
Okay.
Now I can move these sections. Now I'm going up toward your head. And at the next level, the L4-5, oops, I'm going the wrong way. At the next level, so this is the spinal canal, but it's gone. It's gone. There's no, yeah. And where there were before holes that the nerve roots could go out, now we have nothing. So the foramina, the holes that the nerve roots go through, have been completely plugged up. The lamina is still the bone, but the ligament around it is thickened, and that thickened ligament is compressing your nerve roots and squeezing down on them. And this is what is causing your pain. That kind of pain is called neurogenic claudication, when it's pain in your legs with walking, like you originally got on the elliptical. And it's called radiculopathy, a single nerve root, when the lamina is pinching the nerve off to the side in what's called the lateral recess. And your lateral recess is pinching your L4 nerve root. That's the one that comes down the back, crosses over into the inner part of the ankle, which is where your pain is. You do have a bulging disc, but the vast majority of your problem is coming from the stenosis. Your problem is spinal stenosis with central and lateral recess compression.
Okay, that sounds better. I have all these exercises that I've been doing is all focused on trying to strengthen the trunk and relieve some spinal stenosis. I've done absolutely nothing towards a bulging disc. And that kind of distressed me just a little bit, because I thought, well, here's, a couple of years that I could have been trying to reduce a bulging disc if that was the real problem. But yeah,
it's the stenosis.
Yeah. Okay, good.
All right, you ready to talk turkey, what we can do about this thing?
Absolutely.
All right. First, before we get into your treatment options right now, I just want to congratulate you. You may have set some kind of record for ineffective treatments for spinal stenosis. And part of this is your own fault, because you knew you were seeing the surgeon, you were trying to avoid surgery.
Yes.
But can I give you a list of things that have been very carefully studied, proven not to work, and that you have had in the last 2.5 years. Physical therapy.
Mm-hmm.
Can't make a small hole bigger. Dry needling. That's about releasing anti-inflammatories. This is a compressive condition, not an inflammatory condition.
Mm-hmm.
Injections. Of course they work. You know, when you're having a baby, if you have an epidural, it relieves the pain. It was having the baby that relieved the pain, not the epidural, right? In the long run.
Yeah.
The medication Neurontin, which is one of the dirtiest drugs on the planet. Tramadol, which is a very dangerous and potentially addictive narcotic. Synthetic, like fentanyl is a synthetic.
Mm-hmm.
Flexeril, a dirty muscle relaxant that has no value in the treatment of spinal stenosis. And now, to make matters worse, as if all of that wasn't bad enough, you've now got a neurosurgeon recommending, it sounds like he's recommending you have a fusion in addition to your laminectomy. And that is a classic error in the treatment of spinal stenosis. So you, sir, for all the world, you seem like such a nice guy. Why are these people out to get you? This is horrible. Your treatment's been garbage, and I'm sorry. I know you were trying to delay surgery, and it may feel like that's what happened, but all these doctors should have known better. That none of those are acceptable treatments for this condition, and they shouldn't have been offered, and they shouldn't have been done. But anyway, there's no point in crying over spilled milk. We are in this condition today, and the good news is you need a laminectomy, and the better news is you're going to do great. You do not need a fusion. Everyone has a little disc bulge. A laminectomy can be done by a minimally invasive surgeon with a 3-day. Most of the recovery is 2 to 3 days. You have this on an outpatient basis. They go in and open up those holes. They just raise the roof and open up that space where the nerve is being compressed. The results are usually good for life.
Great.
You need a new surgeon, though. You need a surgeon, a neurosurgeon or an orthopedic spine surgeon who is minimally invasive and competent. And I don't know how big that town you live in is, but you may need to drive to get to them.
Well, yeah, I'm right here in the St. Louis area, and this is one of the university hospitals. So,
well, we got to go. It's just a garbage. It's a garbage recommendation. Usually a university hospital is going to be very safe, but this was not. We need to find you a minimally invasive neurosurgeon in the, I lost your video, by the way. I don't know if
I should be popping back here.
Oh yeah, you're back. You okay?
Yeah.
We need to find you a good a good surgeon, spine surgeon who can handle this problem on an outpatient basis and fix you up and get you going. And if it's okay, I'm going to ask Phoebe to do a little research on that area and come up with some names that'll work for you.
That would be fantastic.
All right. Any questions?
Not really. Is one thing that I always make sure anybody who's been involved with my back thing is I also had an injury 2012 or so. It's a T12 L1. And I can duplicate all of my pain that I have today, other than the lower back pain, but all the pains down my leg by just taking a roll-on ball or something and rolling over that area. It's mostly healed up, and if I don't pick on it, it doesn't cause me any problems. But,
yeah, this is your L5, 4, 3, 2, 1.
Mm-hmm.
And you see how normally the vertebral bodies are square, but this one is crushed up here.
Yeah.
This is your old L1 compression fracture that is healed up. Almost certainly what happened was you changed the, because everything else in your back is so good. You just changed the dynamic of your back. Look, if we follow in this view down the spinal canal, the white lines are the fluid that is buffering it, and then we get to there.
Yeah.
It's just like a boa constrictor around the spinal cord. And then it opens back up and everything's fine. And when someone has one level of a problem, it's almost always relates to trauma because it's not your natural history to have this. All the other levels don't have it. How'd this level get it? Right. Trauma. Okay. So, but yes, thank you for mentioning that, but you're okay and doesn't change the plan at this point, which is definitely laminectomy.
All right. Sounds great.
All right, sir, we're going to look it up and I'll get back to you. Will you come back on the show and talk about the doctors?
Yes, I'd be glad to do that. One other question, real quick, is I've watched all your videos down to the balance ball.
Thank you.
And do you recommend me using those exercises that you were doing on the balance ball to I'm trying to get in
Definitely.
shape for a surgery. So,
Yeah, the best rehab is prehab. Yeah,
okay.
yeah, for sure. Go at it, and you're not in any danger or anything. Should be safe, and you can do it.
Thank you very much.
All right, good to meet you. We'll talk again
Good
soon.
to meet you. Talk to you later. Bye.
Bye.